Diabetic amputations are on the rise in the St. Louis area at an alarming rate, which could be related to poor circulation or the medical term, which is peripheral artery disease. Today's Ask the Expert is sponsored by the Midwest Institute for Non-Surgical Therapy, and I'm joined by Dr. Akiwande, Dr. A, also known as Dr. A. Thanks for joining us today.
Thank you. And actually today is Peripheral Arterial Disease Awareness Month, so it's a good time to actually discuss this.
And it's very important because awareness is important, the more you know. And Dr. A is walking us through the cause of peripheral artery disease. So where does it all begin?
Absolutely. So amputations keep going up in St. Louis, and the reason why it goes up is because there's a lot more diabetes, a lot more obesity, even smoking in Missouri. And because of that, these conditions cause hardening of the arteries. They cause the arteries to clog up, causing poor circulation, which is also known as peripheral arterial disease. What that really means, PAD, is that you have poor circulation going down to your foot. When that happens, you have pain, you have numbness, tingling, cramping, difficulty walking, and if it gets severe, it can cause sores in the legs. So a lot of times people know someone who has an amputation, but they don't know the reason why. The reason is because they have poor blood flow to the legs caused by PAD. And then they get an amputation because they don't know their options. They don't know there are other options that we provide.
Absolutely. And you know that knowledge is power, like I just mentioned.
Absolutely.
And so what are some of the symptoms that people have if they start feeling sick? What are they going to feel?
So diabetics, sometimes they have no symptoms, and then they just show up with a sore in their leg because they don't have good sensation in their legs. Sometimes it's numbness, tingling. It can also be pain, or pain while walking, or pain when they're asleep. But the worst symptom of all is a leg sore, and that's the one we're very concerned with because it can cause amputation, or we're trying to prevent them from getting sores.
And we're trying to prevent those sores. We're also trying to prevent leg amputations. And you brought a few tools with you today. They're very small, but they're very important, right?
So yeah, so you know, we're very focused on spreading awareness because of the patient population are very well affected. It also disproportionately affects the black population as well. The way to treat these things, you know, is first of all get a second opinion. But a lot of these things can be treated with a small pinhole incision in either in the wrist or the groin or in the foot. You can see this is a catheter that we can use to inject some dye to find the lesion. And this is a laser. You can see how tiny this is.
So small.
I know. This is what we use to shave off the blood, the plaque in the arteries. So we can get away without surgery. We can treat the patients. They go home the same day, and they don't need major surgery. And then you can prevent them from getting an amputation. And
that's really all you focus on. That's the name of your business, the Midwest Institute for Non-Surgical Therapy.
Absolutely.
Tell us about why you have this approach.
So we have this approach because, you know, initially when I started, a lot of people came to me with sores, and we actually started some grassroots movements before COVID happened. We used to do a lot of screenings, a lot of awareness, but COVID shut us down. But this is a good forum to kind of get this information out there to people, to let people know that you don't have to have an amputation, or you don't have to have major surgery to get this condition treated.
Absolutely. And where can people find you? You have 3 locations. Where can they go to find you?
We do. St. Louis, Farmington, and also Metro East. We're out in Swansea. You can actually find out more about this at www.mintstl.com.
Absolutely. And that information is right there on your screen, mintstl.com. Give them a call at 314-255-2204. Dr. A, thank you so much. We appreciate it. Hey, stick with us, more Studio STL when we come back.